I can hear you well. Yes, yes, Opoku. Good morning. How are you? Hi, good morning. I can hear you. I can. Sorry. Good morning. Good morning, Opoku. I can hear you. Yes, I can. I will just try and put my earphones on. Good morning. Good morning, Opoku. I can hear. Hello. Oh yes. Okay, I can hear you clearly. I've got my earphones on. I'm well, thank you, and I'm looking forward to our coffee chats this morning. Oh, I need to match your one. I need to get the exact same one so we can match. Oh, wow, that is amazing. No, no, we are good. Thank you. We're having a good, it's half term, so we're out and about today. But I was looking forward to doing the show. And yeah, no, everyone's doing well. I was in London yesterday, and because we're talking about COVID, just to say that I was in the underground, and there were like lots of people. I mean, I don't know how people manage in the underground, but they were urging people to put masks on. They were saying, please wear your mask. And there were several announcements during the time that I was in the underground yesterday. And that was a Sunday, obviously, so it was really busy. There were long queues. I've taken photos of how long the queues were, and the underground was just filled with a lot of people. I mean, hundreds of people. Whenever I've seen the underground this full, it's usually been during the summer holidays. So I don't know what was going on in London. I was at the Saatchi Gallery. I went for book fair, and then I went to visit an aunt for prayer. Yeah, yeah, yeah. Yes, yes. So I mean that is something that is happening, and obviously they discussing this because I think we heard last week. I think it caused a lot of controversy when the government started to talk about the possibility of another lockdown. So I think it's all part of the strategy which the government is implementing. So they've got a strategy, a plan B, and so as part of that, obviously, they're looking at other ways in which to ensure that people are vaccinated. Because we know that if the majority of people are vaccinated, that is obviously going to reduce the risk of COVID 19. And Professor Sridhar, I remember listening to one of her interviews very early on in the pandemic and when the vaccines were being rolled out. And she said that the way to ensure safety is getting everyone vaccinated. So it does make sense. So it's just basically it's scientific basis, and obviously the government is now going with that and making the decisions, because not everyone has been vaccinated. Even though it's been offered, most of us would have had our the first vaccine, second vaccine, and obviously the boosters have been rolled out now. And there's obviously, yes, yeah, yeah, yeah. I think, yes, I do understand. I mean, we've been talking about this for a lot of times, and the health secretary, as you've been saying, Sajid Javid, he said we're leaning towards compulsory vaccines for NHS staff, and I don't think it's a surprise, Opoku, because we know that there was talk previously that if people were not vaccinated, that obviously then it would be made compulsory. They would have to leave their jobs. And for myself, working in the health sector, and I'm sure you've got your wife working in the health sector, we have been offered vaccines, and we've been told that we need to have the vaccines. So I think this is again, so Sajid Javid is saying that the threat of not being able to work will ensure NHS staff get the jab. So they say social care workers already have to get the COVID-19 vaccine to be able to work. So it seems this is what they are obviously leaning towards. That's words they're using in the media. So it's obviously just a lot of discussions, and so they want to make it mandatory for about 100,000 NHS staff who are yet to get the first jab. Yes. Exactly. I think you've just answered your question. So, remember when we first started. So, just putting everything into context. The reason why things are going in the direction it's going. So, let's understand what's going on. In the past 24 hours, we've had 39,962 infections in the UK, and we've had 72 new deaths. So obviously the numbers are still rising. So the government is concerned that if the numbers continue to rise, that we will be headed in the direction of a lockdown during Christmas, which we had last year. We had to go into lockdown. All our plans for Christmas was changed. So, in answer to your questions, what we need to do is it makes sense to the WHO guidance initially for COVID-19, which still stands, is that we need to wear masks, we need to social distance safely, we need to sanitize, and we need to wash our hands. And if you get any symptoms, you need to isolate or take precautions to get yourself tested and then treated. So these are still the same precautions that we need to adhere to. And it's increasing. It's really increasing. That's only the cases that we know about. My son today was telling me one of his friends, they've gone to Ibiza and they've come back and he's tested positive for COVID. And so it's young people their ages that are getting it. So it's not just, the adult population. We're looking at young children that are getting it. So it is worrying. But I think coming back to the vaccination, and what again, a disclaimer, health disclaimer, we are not saying get the vaccination. We're just going by what the government is proposing and the government is advising, and according to what WHO has advised the World Health Organization, Dr. Tedros and his team. But I think going back, it feels that in terms of them saying they're leaning towards compulsory vaccination, they're urging people to get their vaccines, is because that is the only way in terms of protecting us from the COVID 19. Because, getting the vaccine, I mean, I'm fully vaccinated, you're fully vaccinated, and I'm in the process of getting the booster, and hopefully others are too. I've heard of people getting boosters, I've heard of children being vaccinated from the ages of 12 to 17 in the UK already. So, in terms of the way the government is proposing what needs to happen, it's very clear, Opoku, and exactly what you said. So we need to get vaccinated. We need to continue with the vaccination program, and also we need to ensure that people are adhering to the guidance. And I think what you said is important. Is why? What are we waiting for? What is the government waiting for? Yeah. Yes. Yeah. Well, yeah, I think it's good. It's you are right in what you're saying that people are there's a group of people that feel that the government is going slowly. But if you can understand, if we put everything back into context, when the news came out last week, and we've been hearing about it for weeks, that I mean, we mentioned it when it first came out a few weeks ago, where they started to talk about Christmas and whether we're going to have a lockdown. And then last week, when the news broke out again about the Plan B, about the strategy of the government, Boris Johnson and Downing Street, we started to hear that people felt that they were being scaremongered. Unfortunately, it's having a balance with that of the government being able to provide the most accurate information, the most accurate guidelines, and what we need to follow. But at the same time, we're managing a lot of people's anxiety. We still have, I've written an article on coronaphobia, as I've said in the Asia Journal of Psychiatry with Dr. Amit Negi, and in that we discuss about coronaphobia. So it comes back to that. People are feeling the headlines. I'm sure you've read and you've listened. I was listening to some other news, and people were feeling that they were actually being scaremongered. When they were heard that there's a possibility that Christmas might be cancelled. Christmas, we might have to go into lockdown. So there's a lot of anxiety. There's a lot of fear around it. There's a lot the coronaphobia, the fear of getting coronavirus, and all what we went through in the lockdown. If we go back to that, you can just imagine we're all in that state of uncertainty, of fear. People are concerned about their jobs, about their finances, about seeing their loved ones over Christmas. Christmas is a time when we are spending with family, as you and I do with our families and friends. So it's the same for everyone else. So it's just, I think the government is trying. I do think they are, and I think, especially because of what has happened in the past when they were criticized about the earlier management of the pandemic. I think they are trying, and they're trying to risk manage. I think people are not listening. Not everyone's listening. Because as I just said, when we started, I said, yeah, I was in London and there weren't many people with masks on, and there were hundreds of people in the tube station. It's not. Yeah. Yes. Yeah, I just want to go back to the point, the discussion about it being compulsory. Yes, Freedom Day was when they decided that masks were no longer compulsory, but a lot of us still continue to wear masks. I mean, I personally, at work in the hospital, we are told that we have to wear masks, and wherever we go, we're wearing masks. Even my kids, we out today, and we all have masks. So I think it's again, I go back to it. It's everyone's responsibility to ensure their safety. But as I said, in this weekend, when I was in London, there were not many people wearing masks, but they were announcing it. They announced it so many times in the underground, on the tubes that I was in. Because I was in central London and in such near the Saatchi Gallery, so it's quite central, and traveling in near Oxford Circus and, all those places. And they were urging people, please wear masks. Yeah. Well, I mean, that that is exactly what you was advising is exactly what the Labour Party is concerned about. Is about introducing the Plan B, and part of Plan B, one of the things is introducing mandatory face coverings. So making it compulsory for people to wear face coverings. So that's one of the extra measures which the Labour Party is urging the government to do. So they are also in terms of Plan B. If we just look at what they're asking, is they want earlier communication and urgently for the public at public level, so that the risk, which has already increased, needs to be managed more cautiously. They're also advising people to work from home, which we had during the lockdown, and they also want the introduction of mandatory COVID passports. So this is what the government is consistently saying, that there seems to be. They're urging that these extra measures obviously need to take place as part of Plan B in in order to prevent another lockdown, especially during Christmas. So the health secretary said in September that the government could. So this was already in September. There was talk of this, about Plan B. So the proposals of Plan B would only bring England effectively in line with restrictions which are still in place in Scotland, Wales, and Northern Ireland. Um, so it seems that it also argues that because of the success of the vaccination program, these small changes will have a bigger impact. So they're saying what could trigger the Plan B. So what would enable the government to actually put Plan B into full force is that it would be hospitalizations, rapid rates of change in figures, and the overall state of the NHS. So Sajid Javed said that there were no plans to bring Plan B in at the moment, but he's warning that these restrictions will more likely to happen if vaccine take up is halted. So, I mean, even though we've had, yeah, go on. The numbers, yeah, yeah, exactly. I understand what Keir Starmer is saying, but Home Secretary Priti Patel, she said the freedom to protest was a fundamental part of democracy, but told the Daily Telegraph it's completely unacceptable for children, teachers, or parents to be intimidated and harassed out of their school by protesters. So, and obviously peddling misinformation and dangerous lies about the life-saving vaccine program. So, it's according to the article, it's 8 to 10 schools have been targeted by anti-vax protesters, and that's been a recent survey that's been done. So they've been getting threatening. So not just people protesting outside the schools and intimidating people. You know how intimidating would that be? But also through emails and legal action and physical harm. So it's quite serious what's going on, and it's quite worrying. I must say. I mean, hearing this today, I'm really concerned. You know, I've got 3 kids in school ages. Yeah, 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 yeah. Yeah. So just to say, I mean, just to say that what Kirsama is saying is that the local authorities should have the powers to impose public spaces protection and orders immediately if agreed by the school. So I think yeah, it's quite disheartening. I'm really upset about that piece of news, but I understand why people. I can understand both points. You know why people are protesting, but at the end of the day, as Priti Patel is saying, we have that democratic right. Everyone has a right to decide, and no one should be intimidated or bullied. So, and then they need to realize that if they are going to do that, the legal action and police will get involved, according to what Sir Keir Starmer is saying. Yep, so I'll get the numbers. I'm just going to refresh the page because I've opened it up earlier on, just reflecting on the numbers. Um, just give me a second. But as I said, the England update, the figures had gone up. Um, and in terms of the worldometer today, the 25th of October 2021, um, 200, 144 um, million, 512, 570 figures in terms of the number of people that have been infected globally, the cases. I think that's just cases, so that's quite a large number. Just reading it out, it's it's huge. It's just saying that out was just mind blowing. It's quite a lot. So just shows you the impact of COVID-19. Total number of deaths: 4,965,637. So we're nearing 5 million globally. In terms of total recovered, which is quite a large number as well, is 221,520,208. And the top five as of the Worldometer, we've got USA number one with 46,312,782. We have, and the total number of deaths is 756,362. India is number two with 34,189,774, with 454,743 deaths. Brazil, number three, with 21,729,763, with 605,682 deaths. UK, number four, so quite worrying still, with 8,773,674 positive cases, with 139,533 deaths. Russia, number five, with 8,279,573 positive cases, with 231,669 deaths. South Africa is number 17 with 2,919,632, with 88,924 deaths. And Ghana is quite low down with number 105 with 129,805, with 1,170 deaths. And as I said earlier, the UK in the last 24 hours, we've had an increase in 39,962 positive cases with 72 deaths. So that's the update. Well, whichever day I'm flexible. So you just let me know. Perfect. Friday will be good. Yeah, brilliant. Yes. Thank you, Opoku. Have a fantastic, blessed day, and let's spread the love and not the virus. And stay safe, everyone. Love to everyone. Thank you.